One of the challenges in healthcare is that software doesn't scale very well. The solutions for health data software fall apart when you get into the millions and tens of millions of patients. When you're trying to deliver a new piece of software, figuring out how your clients can gain value and pay for it is far different than you anticipate. There are tons of ways in which AI is going to be used in healthcare. One of the things that technology has going for it in terms of transformation is it is now the single most aggressively growing market in the various industries that are out there.
Hi everybody, welcome to the Devico Breakfast Bar. Here we speak with different people involved in the business landscape, share their expertise, delve into the latest tech trends, and explore the ins and outs of IT outsourcing. I'm Oleg Sadikov, and today I'm excited to have Duncan Weatherston, co-founder and CEO at Smile Digital Health. Don't forget to subscribe and hit the notification bell so you don't miss new episodes. Hi Duncan, and thanks for joining me today.
Hi, it's nice to see you. Thank you for having me.
Let's start our podcast with a little blitz. I start a sentence and you continue. Entrepreneurship gave me
the freedom to pursue the dreams to change the world that I've been looking for, the ability to work with people that I love, and the ability to try and make a difference to my community.
Entrepreneurship deprived me.
Sleep.
That's the most popular answer. My main superpower is.
That's a tough question. I would say problem solving, but I'd also say achieving consensus.
My main weakness is.
Being as good at understanding people as I'd like.
When I'm afraid, I
don't get afraid.
Nice. Can you tell us about your early career? What sparked your interest in healthcare IT?
I was born in a data center. My father was a programmer from the 50s. I was always interested in IT. One of my first books I learned to read was APL, the instruction set for the language. I've always been around IT. The question was, what was I going to do that was not IT? So I studied a bunch of different things. I've done a bunch of businesses in my life, but always, I've been a developer while I did it, on my own as part of what I was doing or as a business.
What inspired you to co-found Smile Digital Health? Were there any particular industry challenges that motivated you?
So the reason we started Smile is one of the challenges in healthcare is that software doesn't scale very well. In general, the solutions for health data software fall apart when you get into the millions and tens of millions of patients. I was the chief architect for a lot of projects in Ontario that focused on delivering data for 15 million people. That is labs or drugs or diagnostic imaging, all those types of things. And every single solution we bought ended up having to be rewritten by us for ourselves. Our labs were like that. Just everything that we did, the solutions that were bought off the shelf couldn't keep up with the level of both data and the number of transactions associated with that data necessary to provide value at population scales. And so having rewritten a bunch of these things on my own as the chief architect for projects over the years, I thought we can do a better job. We can just write something ourselves with that in mind. And so we started out with the idea that we would solve a problem that fit 15 million people, several hundred hospitals, tens of thousands of doctors, hundreds of thousands of allied health professionals, and grew from there.
Smile Digital Health is well known for its innovative data and integration platform. What were some initial challenges that you faced in bringing this vision to life?
So many challenges there are when you're starting a business like this. One of the core ones was just finding the time to build the product for, some guys who have a day job, right? Where I was a consultant, my co-founder was staff at a hospital. Trying to find the time to build the initial framework, the initial software, get everything going while you have a day job and you're trying to accomplish things is incredibly difficult. Thereafter, getting the model right for our client. When you're trying to deliver a new piece of software, figuring out how your clients can gain value and pay for it is far different than you anticipate, because what you anticipate being the way the client wants to buy it isn't necessarily going to be the way the client's thinking about how they recognize it, either in terms of cost or in terms of ongoing budgeting. There's just so many of those challenges. And then lastly, there's always a challenge finding the right model for scaling with people, right? So you can get 10 clients or 15 clients, but how do you build a solution which is going to grow effectively and scale both from a business sales perspective and from a market demand perspective is a completely different question that's incredibly hard to master. Or, and if it was easy, everybody would do it.
Looking back, is there anything you would have done differently in your journey?
Hindsight's 2020. So of course there's lots of little things that I've done differently. Knowing then what I know now, I think my main efforts that I would have sort of put more time into are around the real sort of business and sales model of the platform. We knew intuitively why it was valuable. So we were comfortable individually going and selling it. I can sell my platform to anybody in healthcare because I know the values of it. I understand the challenges they're facing. We can walk through together and sort of explore how we can be transformative for them. That's not a thing you can package and make easy for others, right? So as you scale and as you grow, the ability to think on your feet about the value prop of the solution that you have in your head needs to be translated in such a way that anybody can understand it and anybody can sell it so that it becomes more commoditizable for the audience you're dealing with. I would go back and do that groundwork right at the start. I would have a much more concrete model about who wants to buy it, why they want to buy it, what the thing I'm going to focus on is, because just because I'm comfortable sort of trying to provide solutions to people doesn't mean my business is as comfortable in that milieu. It's way better off in an environment where they can explain why they want to buy it and why they want to sell it.
How did you and James Agnew divide roles and responsibilities while building Smile Digital Health together? And what makes your partnership work?
Goes a bit back to my history. I've owned businesses before where I was the techie and the other person was the techie, or I was the techie and someone was the business guy, or I was the techie and someone was the business guy and someone's the sales guy, or I was and on where I was the techie. I could never make my business partners understand what I wanted to sell from a technology perspective. The only other time in my life where I've had success, we were two techies doing techie thing. This time, I finally bit the bullet and said, I'll be the business guy. And I try very, very hard not to be the techie because James has that role. And he's doing a great job of it. That is the secret to it. And James is fantastic. He's a lovely man. He's intelligent. He's hardworking. And he's tolerant of my occasional forays, despite my promise to stay out of technology into his technology space. The secret is that we are incredibly compatible from vision perspective, incredibly compatible from a work effort perspective, and incredibly compatible from technical background. But I have intentionally tried to stay focused on business. And that's been a success, secret to success for Smile.
It's one of the rare cases when it works. Normally it doesn't work when a techie guy moves to business and it stays away from tech decisions. So it's really hard to implement in real life.
My first businesses that I did, I bought and sold things. I bought consumer products, took them to flea markets to see what would sell. If they sold, then I would buy the lot and then sell the lot. I started off in my life in terms of my work directory being a sales guy, right? Despite like I said, I'm a techie. I've always been a techie, but I've done lots of things that aren't technical. I put pants away in clothing stores. I've done everything.
What advice would you give to someone looking to start a business with a co-founder?
You're getting married. You'd better be comfortable with the person that you're getting married to, right? Or I would say that another way of putting it is the consequences of your decision about partnership transcend the immediate activities you're doing and have to last as you grow, as you scale, or you have to have some mechanism to agree to separate, right? Either you need a prenup. In fact, I'd encourage everybody to have a prenup in this particular marriage, or you need to be so confident that this person is going to be right for you for the coming years that you can work with them. If you can't feel confident that you trust this person enough, that when you are working 20-hour days and having all the conflicts associated with clients and all those other pressures, if you can't feel comfortable that you're going to figure out how to work through all of the individual challenges in that environment, you should be super careful about partnership. It is every bit as intense as any other strong relationship in your life.
Over your 30-year career, what are the biggest changes you have observed in health tech?
Everything changed. I mean, so if you think about in the time that I've been doing it, when I first started working meaningfully in healthcare, I was trying to help doctors get connected to the internet to be able to do interesting services like, radiology images at home before they go rushing in to do the radiology at the office. So they could do, criticality assessments and stuff like that. The transformations in the intervening years since the late 90s, we've seen the rise of genomics in ways that would never existed. We've seen deployment of mobile services the way we've never seen it before. We've seen the creation of at-home monitoring. We've seen devices on everybody's fingers that's participating in health. We've seen the rise of the clinical interfaces being the primary mechanism for doctors to interact with their world, burnout as a consequence of all of the EMRs. We've seen transformations in the capabilities and longevity, like the entire system. It's such a transformed industry that it's hard to differentiate which piece is the most transformed. Everything changed in the last 30 years, and everything's going to change again in the next 30 years. There's so much technology in motion right now for healthcare. It is the focus. One of the things that technology has going for it in terms of transformation is it is now the single most aggressively growing market in the various industries that are out there. If you are at the forefront of the most aggressively growing market, you get all the attention of people trying to invest and make money. It then drives the innovation in a way that sort of is a self-feeding cycle. Healthcare is at the start of that health-feeding cycle for the next 25 years. We're going to see changes in genomics. We're going to see changes in the way that personalized medicine works. We're going to see the use of AI and ML kind of ubiquitously in the places where it's going to be able to add value. We're going to see the use of predictive algorithms throughout the delivery of care. We're going to see transformation from sort of a provider focus to a consumer focus in the coming years because the capability is going to exist there. We are right at the cusp of an entire change in the way that people interact with their health, the way that changed with banking changed, or the way it changed with music, or the way it changed with ordering food. Everything about healthcare is about to go through that same transition that everything else on the internet did. It's going to be an amazing time to be engaged.
How do you see AI impacting healthcare tech?
It's going to be ubiquitous, right? AI is ubiquitous in all service industries because it manages the way that you can interact with customers more effectively. It enables efficiencies in the way that communications are established. It enables efficiencies in the way that the problem is assessed. It enables efficiencies in the way that you parse large amounts of information, looking for outcomes. There are tons of ways in which AI is going to be used in healthcare. As we go forward, it's going to provide tooling that enables the simpler tasks to be handled automatically between patient and data. It is absolutely a transformational technology. There's a lot to come in terms of how we use the characteristic elements of AI. I mean, at the end of the day, AI, as we see it, is essentially the adaptation of neural nets to outcomes. And the adaptation has the same challenges that, learning and knowledge do. It's necessary that it has a degree of inaccuracy in order for it to be effective, which makes it somewhat more challenging for healthcare where inaccuracy is a critical failure. One of the areas we're going to see a lot of advantage is the combination of AI and heuristic algorithms, where you can say, for sure, in these circumstances, these things need to be done. And the assessment is what's the circumstance so I can figure out what needs to be done, just like we do with healthcare today. In that sort of conjunction of use case and function, we're going to see years of alignment. But at the end of the day, it's going to look a lot like what I said earlier on, a mechanism to support personalized care. It'll be between you and your device and your knowledge tools that provide you with the bulk of your day-to-day health information. And then when you need very specialized care, there's going to be groups of people who are able to manage the ecosystem of technology available to you to help you make the right decisions as you go through it. The way the care model we see today is going to transform.
I read an interesting article today. They made a test. There were 3 testing groups. The first group were simply doctors, and they provided right diagnosis in 75% of cases. The second group was doctors that used AI. The accuracy was 78%. And the third group was pure AI, and the accuracy was 90%. So it's an interesting observation. I'm not sure how can you use AI right now in real life, especially in treatment, but we're coming to this for sure.
For sure. And if you look at the cases where they study these things, they are a little bit aimed at demonstrating the value of AI. The real world scenario where people are working with clinicians is more complex than the models that the AI systems are testing. This really is, the ones I've seen so far have been, given a set of well-defined characteristics, can you diagnose this complex problem? But that is not the main thrust of healthcare. The main thrust of healthcare is, given these people with these conditions that are known and established, can you work with those individuals to help them through their challenges? And AIs are great at certain things. AIs are great at compassionate letters, and they're great at comparative analyses of textual content. But where AIs fall off the end of the wagon is when the words in the existing documentation lead them down the right pathway, they don't have good checks to catch themselves from the mistakes they make. And so everybody who works with AIs comes to the conclusion that they're great tools, but they're not good at the whole picture. I mean, my friend, which I find was a deep friend of mine, likes to call ChatGPT a lying liar. He's like, it's great, it gives you everything until it doesn't. And it doesn't tell you that it's lying, it just lies to you, right? And so I think one of the challenges we face with the AIs is they're still lying liars. They're lovely, they want to do things, but their algorithms are structured in such a way that if they don't know the answer, they make it up. That's as a consequence of what's the next most likely word, not what's the logical structure that we're dealing with. And so I think the character of AI in healthcare has to accommodate both those factors. When they're right, they're right. When they're wrong, they're wrong. They don't say, I don't know. They just do what they're trained to do, which is fall off the end of the word pathway. We're coming to a time when we're going to have better agents, better ability to do this, better tests. One of the things we can do is use the heuristic side to do double checks to see if we've gone completely off the beaten path. Because one of the things that's clear on that is if you call them on and say you're wrong, the LLMs are like add that piece of information back in and go, oh yeah, that's wrong, I'll try again, right? And so if we can find a way to short circuit that and get those loops into place, we can get much more accurate. And we can also then say, no, this is just flat out wrong. Ignore everything. This don't say those words you're about to say to the patient because it's broken. So we will get to tooling that solves the problems, but we're certainly not even close yet.
Smile Digital Health has an in-house team, which is a big decision in the tech industry. What led you to prioritize an in-house approach over outsourcing?
Well, we are developers, right? Like my co-founder's a developer. I'm a developer. Our friends are developers. We come from a developer environment. That's a thing that we've got in spades. It's not hard for us to understand the technical pathway. The area which we've been better off outsourcing was business acumen in the early days. I mean, obviously we did well enough. We grew from bootstrap to 50 million and more in revenue. So we're doing well. But I would say our in-house outsource decision should have been around business models and engagement because we're techies. Even though I'm not a techie, I get it. I'm a business guy, but we're techies.
Maintaining an in-house development team can be challenging. What strategies have you employed to effectively manage and nurture its internal development talent?
There's lots of challenges, right? So I can enumerate some of the challenges. One of the challenges is growth. As you grow, the people who are good in a 5-person company aren't necessarily good in a 50-person company, who aren't necessarily good in a 500-person company, who aren't, et cetera, right? Managing that challenge amongst your teams, regardless of whether they're techies or not, is a challenge, but it's especially a challenge with techies because the character that they depend on is transforming around them, and it is a change management nightmare. I would say the other characteristics are having enough money, right? Unfortunately, right now, it's a competitive market for people to get jobs. There's tons of people laid off in the technical industry right now, and so there's a bunch of people out there. But that's the cyclical thing, right? When we first started, everybody could just hold up their hand and would get hired by Meta or Google or Apple or somebody at crazy rates. And so we were competing in an environment when there's a strong demand, there's people out there with billions to spend. And in fact, they hire competitively to keep them out of each other's grasp. So the model was artificially pushed one way, and then the model goes the other way. There's this surplus of technology capability on the market. And you have to manage that as well, in terms of the way you hire and the people you hire and how that sort of thing sort of flows forward because there's internal pressures as well. So managing a development team really is a thing you need to have a experience at. First of all, me and my co-founder managed a development team. I've managed development teams. It's an area where you have to be aware of what's going on in the market. And lastly, it's an area where you have to be aware of the character of the people you're working with and be able to support them. It's not an easy thing if you're not a techie, right? If you, as a business, like I was a consultant, right? I spent a lot of my time going in and helping people as an outsourced individual in their company to do architecture, deployment, or coding, or whatever it happened to be over the course of my career. I think the environments where I went in and added value the most were ones in which their primary motivation wasn't the technology, it was some business outcome. I had the biggest challenge when I was in that environment was going into companies whose primary motivation was technology and butting heads with their existing technical teams. And so that's kind of how I think about the sort of the business model. We find the same thing when we're dealing with clients, right? Our clients who are building software, who use our platform as a component of their software, are the ones who have the most structural challenge in working with us because they've got a vision they're trying to implement and our code does the thing it's supposed to do and like, well, why isn't your code doing this? And that kind of play, it's great, we love to do it and it adds value, but it's very different from going into an environment where someone says I need to be able to share health records with people for these reasons, help us solve that problem. In that environment, we're going in to solve a particular business problem and our interaction is much more highly focused on our ability to solve a business problem. In the technology environment, it's about our ability to deliver on the technical needs that a technical team has, fully aware that if they really want to, they can start writing things themselves. And that's the dynamic that happens both for outsourcing, for software companies, and for everybody else, is that fit between, your value prop and the client's needs.
Reflecting on your business operations, are there specific tasks or projects that you believe could potentially benefit from outsourcing, and what criteria would you use to determine their suitability for external collaboration?
There are two types. So let's talk about the companies like mine right now, and I'll talk about my history afterwards. So for companies like mine, the real value for outsourcing is in partnerships and implementation, right? So if you think about how a company that's got a software platform needs to scale, either I have to hire people for every implementation that I think is available for our platform, which is pretty substantial given what we do, or I partner with people to implement my platform in potential clients' environments. That latter one is the more sensible model because then I can focus on building software and making the capabilities I want rather than project management, implementation issues, and all the rest of the technical integration challenges that go with that type of work, right? So for me, the partnership model that is great and where outsourcing is fantastic is if a client of mine needs to implement something, they rely on my expertise and my knowledge in the industry I'm in, a partner that I can outsource to that has gained that level of expertise that we have and is able to implement on our behalf is invaluable to us. We can do that every single day of the year and we can grow more aggressively together. Coming in to tell me how I'm going to build my core platform is much more challenging because this is my IP and a thing that I have to be able to support going forward, and I have to be able to have the flexibility to make decisions against. I mean, we can work with people in that environment. I have hired people and contractors to write code, but ultimately the ownership and the ongoing understanding and knowledge has to remain in-house because otherwise when I want to make changes, I'm trying to figure out what somebody else did and try to make that fit into my core. It's a serious structural challenge. Historically, though, when I was on the implement healthcare side or I was on the implement a solution side, I was always brought in to solve a problem that the local team wasn't equipped for, right? How do you architect for 1 million people or 10 million people or 20 million people? How do you think about this solution we're trying to deliver in a context that has these characteristics in an environment where they're used to managing technology, not developing technology? If you walk into an environment where the history is managing the technology, where they operate a set of systems they've bought, where they have a set of capabilities that are provided by a set of vendors, in that ecosystem, if there's any development to be done, if there's products to be built, well, your job is to essentially build a product that is supportable that you can leave behind for them to manage and operate, and then a pathway for them to get additional support if they need it, much like a product. And so the way I think about the distinction is outsourced software development is essentially outsourcing product development for a person that most likely doesn't have a resale need of it. It has an ongoing implementation and operation need of it. And in those environments, it really shines.
As we conclude our discussion, drawing from your own experiences, what advice would you give to aspiring entrepreneurs or individuals looking to disrupt traditional industries with innovative technology solutions?
I would say that the thing that you have to be willing to do is give up your life for a little while. The challenge of starting a business is incredibly encompassing, involving. You have to be aware of the fiscal risk you're taking. It's not easy to go out on your own, run out of money, and be stuck in a situation where you've given up the livelihood you had before. You're now in debt for the thing you're doing. It is not an easy path. You have to be ready financially. You have to be ready emotionally. You have to have the time to do it. You shouldn't abandon your small children to go build a business unless that's the way you're going to live your life. You can't do any of these things half-heartedly. I've started businesses a few times in my life, and the ones that succeeded were the ones that I was able to dedicate all of my effort to. The ones where I was able to put part-time in and try it and see if I could get it and get other people to do stuff and what have you, never went anywhere. And I was lucky in that I bootstrapped and never really harmed me having done it. But if you're taking it serious and you want to do it yourself, you have to be prepared to put the time and effort and concentration in. And so you have to have your life prepared for it. If you don't have your life prepared for it, you're going to be in conflict between these two things that are very important. Like I said, it's like a marriage or anything else. You're making a substantial decision about yourself and an entire ecosystem that's going to be dependent on your efforts in the early days. It's very hard to divide your time. And if you have to divide your time, you're going to run into challenges that are probably to your dissatisfaction. So my advice is be prepared financially, be prepared emotionally, be prepared from time perspective, be prepared from a product perspective, review everything, plan and plan and plan again. And then if you're sure you're willing to take the disruption, if you're sure that you're willing to have the risk, if you're sure that you're willing to abandon the other priorities that today occupy your time, if you're sure that you're willing to go when it looks like the going is over, then feel free to start a business. If you're not, really think twice about it. It's a tough, tough path.
Duncan, thank you very much for your conversation, for sharing your experience, insights. I'm sure this information will be incredibly valuable for my auditor. Thanks for joining me today.
Thank you so much for having me.
If you enjoy our discussion and want to stay updated on future episodes, don't forget to subscribe and hit the notification bell. That way you will not miss out on the latest insights and conversations from the Devico Breakfast Bar. See you in the next episode.